This is Late Night Health. Mark Alyn, your host, taking the week off, visiting relatives from out of town. My name is Darrell Wayne. Sitting in, normally I'm on the other side. Actually, I'm in both chairs, if that's literally possible this week. Sort of hosting and pushing the buttons at the same time. We've got a great show planned. Our first guest is Jonathan Graff. We're going to talk about hair loss. Also, Dr. Greg Soleil, a regular contributor, is going to be on the radio program. Josh Lane in the second hour, where we're going to talk about skin. We're going to talk about blood sugar. And we're going to wrap up the program a little later on with a special guest, which we'll talk about in the second hour. It's latenighthealth.com on the internet, and on Facebook, it's facebook.com/latenighthealth. Our first guest is Jonathan Graff. Jonathan has 20 years experience in sort of the hair loss business, but rather than just losing it, Jonathan, can you talk a little bit about prevention?
Well, sure. First of all, thanks for having me on the show. Yeah, there are different types of hair loss. The most common, though, is just something called androgenetic alopecia. Nice, fancy words that just mean genetic inherited hair loss. It's the kind of hair loss you see for most men where you're thinning on the top. You get that classic kind of horseshoe pattern, you're just kind of thinning through the top area.
Is that what they call male pattern baldness?
Mm-hmm. Yes, male pattern baldness, androgenetic alopecia. It's something that just inherited, passed down through the family, combination of the genetics and the hormones that trigger them. It affects both men and women. It just looks different in men than it does in women.
So will someone, if they live long enough, eventually lose their hair?
Well, I think eventually, if we all live long enough, I think eventually we would all just turn to dust because our cells just kind of degenerate. But really, it has to do with whether or not you inherited the gene for genetic hair loss. See, every hair on your head is programmed to be more or less susceptible to different hormones.
Wow.
The weak hair goes, the strong hair stays. How much weak hair did you inherit? That's how bald you're going to be. In men, that begins in typically the early 20s, and it goes along your whole life. For women, it's a little different because they have a different set of hormones than men.
And it's not as prevalent in women as it is in men, from my observation.
Well, it happens just as often, but it looks different. Women don't lose all the hair on the top. Women can get thin behind their hairline and gradually shed hair. Also, because it's triggered by a different set of hormones. So any hormonal event in women can trigger just rapid shedding and hair loss. Any woman who's given birth knows your hair's never looked so good as when you're pregnant, and never looked so bad as right afterwards.
And that has to do again with hormones.
Mm-hmm. Yes, and whether or not the hair follicles are genetically susceptible to them. Think of it like throwing a certain kind of weed killer on your grass, but it's only designed to kill the weeds. How many weeds do you have?
That would be a Roundup.
Yeah.
Yeah.
Yeah. So any hair loss treatment has to address those problems. Right now, there are only 3 with both FDA clearance and with clinical testing and provability to treat those conditions.
But other than the genetically programmed trip down the road to hair loss and baldness, are there things that people can do preventatively to slow down, stop, or accelerate that process?
Certainly, but there are only a few that have clinical testing. That's as I was saying, the problem is that a lot of the things people try aren't addressing the problem. If the problem is a combination of genetics and hormones, you have to address those problems to do anything about it. So
Sure.
Generally, massaging your scalp or using magic shampoos and things don't seem to do much because the problem really isn't a dirty scalp. I lived in Los Angeles for a long time. I've never seen a bald homeless man. If that were true, they should all be bald, and they're not.
Yeah.
And the top of your head isn't dirtier than the sides of your head. Not logical. The things you can do about it, one, for men, there's a prescription drug called Finasteride. Speak to a doctor about it. It's a prescription drug. The brand name is called Propecia. Most people have heard about it. It's a pill that's been around for quite some time. Basically, it stops a man's body from producing the hormone that hits the weak hair and makes it fall out. But it's a prescription drug. Obviously, speak to a doctor about it. There's possible side effects, etc. It is what it is.
Well, the one that was the most prevalent, at least from a media aspect, was Rogaine.
Mm-hmm. Yes, Rogaine has been around for quite some time. Rogaine is a drug called minoxidil. That's what's called a vasodilator. It was originally a high blood pressure medicine.
I was going to say I'm familiar with that term because of blood pressure issues.
Mm-hmm. Yeah. When applied topically, it essentially kind of fools your hair into thinking it's a little more alive than it is the easiest way to explain it. I've seen people get good results with it. The problem seems to be that it requires a huge amount of commitment. You have to rub it onto your head every day and never stop. If you do, the results go away. And as you know, men are so good at lifetime commitment. It's a real male strength.
I understand.
But I have seen people get good results, but because it requires ongoing use, in my experience, a lot of people simply stop. It goes the way of my gym memberships. People stop before the results show up.
What about the success or lack thereof of some of these hair transplant techniques?
You know, hair transplantation is extremely successful. What you're doing is taking some genetically strong hair from where you have a little more than you need, typically in the back, and moving it to where you need more. So it's artistic redistribution, I guess is the best way to explain that.
But the hair on your back and the hair on your head just doesn't look the same.
Well, it can. It has more to do with two factors. One, do you have enough in the back to move it? You know, do you have enough supply to take care of the demand? Second, are you going to a doctor who is artistic enough to make it look like it always grew there? It's more of an artistic endeavor than a medical. It is a surgery, but it requires a great deal of artistic skill. Think of it like painting. I can paint. It just looks bad. Right. You have to know where to put what in such a way that it's extremely well done. And there are some very good doctors doing that, but it's an expensive surgery. It doesn't prevent hair loss, but it can replace or give the appearance of putting hair where there is none, where it's already gone. So if it's repair, it's not maintenance.
I guess anything done badly can look artificial, or like when you plant a field, so to speak, you can tell it's been planted by a human being because it's all in straight rows and it's all very neat and organized and spaced well. And sometimes hair transplants appear the same way. Yeah,
they can. It has to do with the artistic ability of the doctor. Human beings are very linear creatures, so we will naturally try to put things in patterns. And an artist doesn't necessarily think that linearly, so nature doesn't follow direct, distinct patterns like that. So it's very hard to fight that urge.
You need the Jason Pollock of hair replacement. It's just sort of splatter stuff on the screen.
Yeah. Well, yes, it has to be kind of organized chaos, I guess, because your hair does have a flow to it, and you put the right texture, color, angle, direction. You may know that, if you can't comb your hair the wrong way, it just falls back. That's because there's a flow to it. It's very hard to duplicate nature. It's easy to imitate it, but making something that looks like it was always there or that nature did it really requires an artist.
I love when you go in to get a haircut and they said, which way do you comb your hair? So, well, the way it goes, right?
Well, women have a concept of good hair day and bad hair day. Most men just want a hair day.
That's right. We're talking to Jonathan I'm sorry. Let me take that again. We're talking to Jonathan Graff about hair loss, hair rejuvenation. And why don't you tell us a little bit about some of the products that you think work best?
Well, there's only three. There are hundreds of things out there, and there's been no shortage in the last 20 to 30 years. Certainly people know that. Every time you turn around, there seems to be something else to try for hair. I'm a fan of anything that works. On the other hand, I'm also kind of a cynic, having been in this industry for a long time. The only three things that right now with both FDA clearance and clinical evidence published that show that it is effective are minoxidil, which is the active ingredient in Rogaine, again, applied topically twice a day forever. Propecia, which is a prescription drug only for men, which may help stop hair loss, but again, prescription drug, talk to a doctor about it. And a technology called low-level light therapy, which is phototherapy. It's using the right wavelength and frequency of light to cause a chemical reaction in the cells that basically stimulates them into growing more hair, into being more active and growing more hair.
So this is like a grow light for your head.
Yeah, I guess that's a good way of putting it. Yes, Human beings are photosensitive. Our cells respond to light at different wavelengths. They cause different chemical reactions. The secret is getting the right wavelength and strength that gets the chemical reaction you want and doing it enough to get results. The technology has been around 25, 30 years for treating acne, wound healing, skin conditions, collagen, and helping stimulate damaged hair follicles to help regrow hair. The difficulty has always been getting people to do it enough for it to work.
So this is when you mentioned some of the previous applications, the term sun lamp comes to mind.
Mm-hmm. That's a different kind of light, but the idea is similar. A sun lamp uses a different wavelength and different type of light to basically the chemical reaction they're looking for there is to turn your skin brown, blast the cells to turn them red or brown.
Right.
The light used for treating thinning hair is specifically between 650 to 670 nanometer wavelength, which is one of the reds, right? It's a specific kind of red. And you want to put about 3 or 4 joules of power per centimeter squared on your skin. Again, this is a lot of fancy math stuff, but it basically comes down to get the right wavelength at the right power and do it enough for it to work.
We're talking to Jonathan Graff about thinning hair, balding, hair replacement, some of the therapies, some of the techniques. You're listening to Late Night Health. Our conversation with Jonathan continues in a moment. You can always join us online at latenighthealth.com. It's Darrell Wayne sitting in for Mark Alyn.